Are bunions genetic? Make sure that you watch this video because I'll tell you whether or not your bunions are genetic. I'll give you some great top tips to help with your bunion, and I'll give you a great solution so you can avoid surgery for your bunions. So are bunions genetic? So yes, they are, but bunions are almost like a secondary genetic trait. So you don't come out of the womb and you're predetermined to have a bunion. What you inherit off your parents is you usually inherit a level of misalignment, or what we call subluxation, through this area here. So subluxation is a fancy word for bones not in the right place or some level of misalignment. And that misalignment or subluxation often affects the way you stand and the way you walk. So a bunion primarily, amongst other things, which I will talk about, is primarily caused by the way you stand and the way you walk. And so we see stacks and stacks and stacks of bunions, and this subject comes up all the time. And in fact, we see over 150 bunions a week through our clinic, and we help treat bunions without surgery. So bunions primarily are a secondary genetic trait. And what happens is that this level of misalignment affects the way you stand, the way you walk, and causes you to internally rotate. And so what we find in our clinic, if you improve the way someone stands, the way they walk, it has an excellent long-term outcome of their bunion. So just to go back, what you inherit is this bit back here. This affects the way you stand, the way you walk, and it causes compensation down here in the way you stand and the way you walk, and causes you to internally rotate. And of course, because of the way you stand and the way you walk, it causes you to slowly deviate through that big toe, and it happens over thousands and thousands and thousands of steps. Now, we get our adult foot from around the age of 5 to 7, depending on how quickly you develop. And this often manifests itself earlier in females than it does in males, only because females usually develop faster than males. One may say males never develop, but that's another story. But what I would say is that we do commonly see that across the board. So as a result of that, just keep that in mind, that people seem to think that, a bunion is almost like having brown eyes. It's not. It's a secondary genetic trait because of the way you stand and the way you walk. So the good news is, because of that, you can actually do something about it. And the great thing is that if you improve the way you stand and the way you walk, it will help it long term. And in fact, that's how we approach our treatment processes. So when people come in, we assess the way they stand and the way they walk. We often send for a weight-bearing x-ray, and that allows us to further measure that level of misalignment, which you've inherited back here, this predisposition. And then we can come up with a plan to actually improve that level of misalignment, so it improves the way you stand, the way you walk long term. The way that we do this is just a very gentle hands-on technique, and then we give you exercises to support those changes. In fact, the mobilizations themselves actually only take 3 to 5 minutes. And the idea is we work with your connective tissue, your nervous system, we turn on your proprioception, which helps to turn on all of those tissues and improve that level of alignment, and we can usually help it long term. The problem is if it's left and you just leave it long term, eventually you are probably going to need surgery in many, many cases. And the downside of that is that the wear and tear that's happening underneath the surface that you don't know about is the concern. In fact, there are very reliable studies that show 70% of the population over the age of 50 in their big toe have osteoarthritis. Now, we know statistically that eventually osteoarthritis is going to hurt you. And when it does hurt you, you can't go back and reverse it. So the idea of our methodology is that we try and get ahead of this before it actually causes a problem and actually causes you any issues. So if you have a bunion and you want to get it checked out, the good news is, yes, it is a secondary genetic trait, but there is something you can do about it, and your only option isn't surgery. So this is what we offer, our 60% off initial bunion assessment offer. Feel free to click on the link below so you can claim that offer. So it's 60% off, so you can come in and get professional advice by someone who is an expert in bunions. The other thing is that we have a great free report. I'll put that in the link as well, on why you got a bunion and top tips around avoiding surgery for your bunion. And definitely, if you like this information, we've got stacks of other information on bunions on our channel. Click like and subscribe. Our channel would be great. Thank you very much, and thank you for watching.